Morning, Assalamu alaikum. So I just want to recognize you three, Hank Chaudhary, Mr. Alex McCabe, and Kara O'Lean, Director of ECFMG. Thank you for making your time so precious, and we are honored by your presence in this meeting. We are very committed to education. Our focus is medical education. We want to cultivate the best graduates possible, and we want to provide to the supply chain in the US the best residents possible. And these are very bright lot, they have worked hard, and they are here and they're in their young life. And we want to cultivate that, and we want to promote science. As you have seen, there's posters this time. There is also seminars on innovation and on these things. So we really value them, and hopefully we will provide the best candidates for the match. Thank you so much for being here. Thank you.
Thank you, Dr. And we will get started. So I'll start with Ms. Caroline to get her. We have the PowerPoint presentation for all these things. So go ahead and get started.
Thank you so much. Good morning, before we get started, could I just get a show of hands so we know who in the room? How many folks, raise your hand, are prospective students or haven't graduated yet? Okay. Recent graduates? And anyone in training already? Great, thank you. And just briefly, I know we have only a little bit of time, but just to give you a little overview of what I want to talk to you about today, I'm going to give you just a short overview of ECFMG and ECFMG certification, a little bit about the journey of an international medical graduate to graduate medical education, and share some data that I have on our certification volumes, and specifically highlighting Pakistan, and then just share a couple of updates. Okay, great. ECFMG is a nonprofit private organization that was started in 1956, really to address the wave of immigration of individuals who are coming to the United States after World War II. And so our core program was the ECFMG certification program, though we have added a number of other programs since that time. And our mission is really to serve the public. And we do that by assuring the qualifications of international medical graduates through the certification program for those that are seeking licensure in graduate medical education in the United States. We also provide primary source verification services for a number of medical regulators throughout the world. So we're supporting international medical graduates who are relocating to other countries besides the United States. Excuse me. And we also have a mission to support international medical graduates who are applying for GME, both through our ERAS support services. So, the electronic residency application service of the AAMC. ECFMG serves as the dean's office for all international medical graduates who are using that service. And we also have the exchange visitor sponsorship program. We are the sole sponsor of the J1 visa for physicians who are wanting to enter into the United States, into GME or fellowship on a J1 visa, which is a non-immigrant visa. Certification, the reason I'm starting is because certification is really the gateway to the United States for international medical graduates. So if you are seeking a position here, you've got to start with ECFMG. And in the over 65 years since we have been certifying individuals, we have certified over 400,000 international medical graduates from almost every country around the world. Certification is a requirement for entry into ACGME accredited residency programs and clinical fellowships. It is also a requirement for the USMLE Step 3. So if you want to take Step 3, you have to be certified before you can do that, among other requirements for USMLE. And certification is also required ultimately for licensure in the United States. So it's a really important fundamental first part of your journey to licensure in the United States. And the rationale really for certification, I mentioned in the beginning that ECFMG was started from the wave of immigration that was coming to the United States. And in that wave of immigration were all types of individuals who were seeking to to do their professions, things that they were educated in the United States, and that included physicians. And so a number of organizations in the House of Medicine, including the Federation of State Medical Boards, sort of got together and said, we're going to support this organization and task it with assessing the qualifications of those international medical graduates, because there really is no standard in terms of determining equivalency, because curriculum, content, quality, and duration of medical school and medical education around the world varies so greatly that it would be really impossible to say this education system is identical to the United States and this one isn't. So that is how the certification program was born. So any international medical graduate who can meet the requirements is then deemed acceptable to apply and to enter into GME in the United States. So the journey for an international medical graduate does start with applying for certification, and we have over 35,000 international medical graduates every year who start the application process for certification. Certification is going to include a number of things, right? So there's school eligibility requirements and an individual requirement. There are over 3,500 medical schools in the world. Not all of them are acceptable to ECFMG. So individuals have to check first to make sure that their school is acceptable, that the program, that their degree is acceptable. Certain programs at certain medical schools are not acceptable. And once you pass those, then we do have individual eligibility requirements that are mostly related to transfer credit. So the number of medical schools that an individual attended and transferring sort of from one school to another, there are restrictions on that. Once you clear those, you're going to have to complete the medical science examination component of certification, as well as our credentialing requirements. And the examination requirements include the USMLE Step 1 and Step 2 CK, which Dr. Chava will be talking about in just a moment. Those are really important examinations and a critical part of our certification program. There's also a clinical skills component and an English language proficiency requirement. And those are currently met through the pathways program that we have. There are 6 different pathways that individuals who need to meet these requirements can go through, depending upon where you are in your career. It will determine which pathway you will come through. And included in that pathway, you also need to take the occupational English test in medicine and pass it. So that will meet the clinical science and skills components of certification, as well as the English language proficiency. And then ultimately, when you graduate, we're going to verify your final medical diploma and transcript directly with the authorized officials at your school. That process generally takes folks around 3 years. That doesn't mean you can't do it sooner or you can't take a little bit longer, but generally we see on average that individuals complete that process in a 3-year period. So those that are about to complete the process or have just completed the process will then be able to participate in applying to residency programs and a match. So we're certifying over 11,000 individuals every year. And we are seeing over 13,000 individual international medical graduates who are applying to residency programs and to the match every year. So you can see and I have some data, not everyone matches. And so some folks will come back, and it's generally around 2 to 3 cycles where you see folks ultimately will then be able to match to a position if they're going to match. And then we do see about 8,000 individuals. It's increasing. I have some data on that as well, on the international medical graduates that are matching into programs and then off to GME and then licensure. So here's some data for you, just interesting. And I don't know if you can really see it so well, but this is over the last 20 years, the number of certificates that we have issued to international medical graduates. And you can see it has fluctuated over time, but generally we're issuing on average about over 10,000 certificates every year. And the orange bar, if you can see it, represents the certificates that we have issued to graduates of medical schools in Pakistan. And in 2023, you can see that over almost 12% actually of all the certificates that we issued were issued to graduates of medical school in Pakistan. So you're a really important part of the international medical graduate community here in the United States. This also is a different type of breakdown, top 5 countries of medical school. Again, over the last 20 years, the orange bar there is Pakistan. And you can see that is definitely within the last few years has been a significant increase in the number of certificates that are issued to graduates of medical school in Pakistan. So you have been, again, over the last 20 years, a really important part of the international medical graduate community here. So some data on the match. The first year residency positions that were offered in 2024 were about 3% higher than the number that were offered in 2023. So we are seeing an increase in the number of positions offered. And this also shows the number of IMGs that are participating overall and how many of them matched. So it is increasing in terms of the number of folks that are applying for the match, but also what is increasing are the number of international medical graduates who are matching to programs. You can see the percentage kind of varies a little bit, but almost every year is over 60% international medical graduates who are applying are matching to residency programs. And then just a little bit about our J1 visa sponsorship data here. We are, as I said, the sole sponsor for the J1 visa for physicians who are seeking GME and fellowships in the United States. And then you can see there's been a significant increase over the last 10 years in the number of individual physicians that we are sponsoring on a J1 visa. So the increase even from last year was up about 6% from the year before. We're sponsoring almost 15,000 international medical graduates on a J1 visa. And again, important to note, I think here is Pakistan represents almost 10% of all of the J1 visas that we are issuing. And again, you can see the number is, I think it's almost 60% increase in terms of how many J1 physicians are training and serving patients in US teaching hospitals. And as a note, I'm not sure if folks are aware of this or not, but international medical graduates make up almost 30%, somewhere between 25 and 30% of the licensed physicians in the United States. So it's a really, really important group that our healthcare system and our public really relies on. So I also want to say thank you for that contributions to the U.S. healthcare system. And just some updates, then I'll wrap it up. We have a new CEO, Dr. Eric Hombo. He comes to us from the ACGME, and he has a very deep background in research and in assessment. So we are very excited to have him. He's just passed his 6-month mark. In terms of government relations and advocacy and the work that we are doing, Dr. Chowdhury is going to talk about the Advisory Commission on Alternate Pathways, so I'll let him do that, but we are very pleased to be part of that work in joining the Federation of State Medical Boards and the ACGME in that work. In terms of advocacy, we have a Journeys in Medicine blog that is entering its 5th year, and it just published its 75th blog, and it is a blog for J1 visa trainees and alumni to share their personal experiences with each other. We also initiated a grant program last year, and we're very pleased to award 3 $5,000 grants to J1 visa physicians who are intended to use that grant money to improve the wellness of J1 physicians in their training programs. We'll be pleased about that. We'll be doing that again this year. A note on our recognized accreditation policy. Many years ago, in 2010, we implemented a policy around the accreditation of medical schools worldwide and what that would mean for ECFMG certification. So I think what's important to note here is that schools are not required to be accredited for folks to be ECFMG certified, but we will begin publishing information about whether or not a school is accredited. And the Pakistan Medical and Dental Council was just recently recognized in February of this year by the World Federation for Medical Education. And so it is listed among those accrediting agencies that are acceptable under our recognized accreditation policy. And one last note, ECFMG certificates that are issued are expirable on the basis of the pathway. So that pathways component of certification is expirable. Once IMG enters into residency training and completes the first year, PGY1, then the certificate becomes permanently valid. So you wouldn't need to revalidate that. But there are some folks who either chose not to or were not able to enter into a program in time, and those certificates will be expiring soon. So we will have information about how to revalidate, what the process will be for revalidating that pathways component of certification if folks want to continue to apply to programs. And that is coming this summer. So on that, I will hand it over to Dr. Machara. And I'm looking forward to questions.
Thank you, Kara. Really delighted to be here with you this morning. I really appreciate the guidance that you all have been receiving in these sessions. Prior to joining the National Board of Medical Examiners 4 years ago, I was the Senior Associate Dean for Medical Education at the University of Miami in Florida, job I held for many years. So I wore that hat as well prior to joining NBME and the USMLE team. What I thought I would do in a few minutes is sort of give you a worldwide tour of USMLE, past, present, and future. And it starts really in the 1990s. This is a picture of the boards of the NBME and the Federation of State Medical Boards, where they got together to really design and think about a single examination for medical licensure. This is where the USMLE was born. In 1992, step 1 was given. I actually took that exam paper in pencil in 1992, the first cohort. And this past year, we just celebrated the 30th year of step 3. So this is sort of the origin and the roots, if you will, of USMLE. As you know, the USMLE has 3 components. Step 1 and step 2 CK form what we call decision point 1. So this is an assessment to enter supervised practice. And step 3 forms decision point 2, entrance into unsupervised practice. As you can see, they're offered year-round. Step 1 and step 2K offered at Prometric centers in the US and internationally. Step 3 only administered in the US. You can see the length of days and the number of multiple choice items per each of the steps. Step 3, in addition to multiple choice items, also has 13 case-based clinical simulation exercises that you go through on day 2 of the exam. The mission of the USMLE is to provide licensing authorities, state medical boards, with meaningful information about physician characteristics that are important and essential to practice safe and effective patient care. We engage medical educators and institutions, state medical boards, and practicing clinicians in the design and development of the exams. We do everything we can to ensure fairness and equity using the highest professional testing standards. And we continue to develop and improve our assessments for licensure to ensure that we're adequately and appropriately assessing physicians in a more accurate way. Said in another way, and this is a really important point to highlight, despite everything you've heard, USMLE's primary purpose is really to provide a critical independent assessment as a component for medical licensure. So providing state medical boards with an independent assessment separate from assessments for medical schools that will inform eligibility for licensure. Really important point. As you probably know, step 1 went to a completely pass-fail outcome in January of 2022. After years of discussions with stakeholders, this transition went into effect there. So step 1 is only now, the outcome is only provided in pass-fail format, no 3-digit scores, and there are no plans to reverse that decision. We hear this over and over again, so I spend a lot of time out on the trail, if you will, reminding people that there are no plans to reverse that decision. It remains a pass-fail outcome only. Furthermore, there are no plans to alter step 2 CK scoring. So step 2 CK, as you know, comes with a 3-digit score in addition to a pass-fail outcome. And there have been lots of rumors circulating about step 2 CK reverting to pass-fail. There are no plans to alter that. So I want to make that clear too. I thought this would be helpful to show you. So this is examining volume and pass rates for the last calendar year, broken down by step 1, step 2, CK, and step 3. And you can see broken down by US and Canadian examinees that come from US and Canadian schools in addition to international schools. That's published on our website. What isn't published is the third line there, which I thought would be helpful for you all to see, and that is how examinees from medical schools in Pakistan do. So you can see the pass rates for step 1, 82%, step 2 CK, 90%, and step 3, 95%. Again, this isn't something that's readily available on our website, but I thought it would be helpful to share with you all here today. Let me mention one of the things we do on a regular basis. The USMLE has a robust research agenda, looking at ensuring that we are assessing everything within USMLE, and in particular, looking at the predictive validity of USMLE. So I just want to share 2 studies. This was a study done back in 2014, actually, looking at the relationship between the USMLE performance and outcomes of patient care, specifically by international medical graduates. This was published by John Orsini and colleagues back in 2014 that showed an association, in fact, between performance on USMLE and improved patient outcomes. This past year in 2022, we published, this past year rather, we updated this particular study looking at all physicians in Pennsylvania, specifically looking at a composite score of USMLE across all 3 steps and patient outcomes, such as length of stay and mortality, particularly focusing on 5 key inpatient diagnoses that are seen on a regular basis, and found, in fact, an association with improved performance across all 3 steps and these patient outcomes. These are really important studies that we continue to do to assess the predictability of the exam. We're now replicating this study nationally in collaboration with the American Institute for Research and the AMA, and we hope to have that published soon and readily available. I would be remiss not to mention something about an announcement that came out in January of this year regarding our anomalous performance. The USMLE program routinely monitors performance patterns, looking for unusual performance patterns that could question the validity of the exam. We do this on a regular basis. And after an extensive investigation, we in fact found anomalous performance in a subset of examinees, over 800. Remember, we administered the exam to 130,000 a year. So this is a small subset of examinees where we found anomalous performance that raised the question of validity of the exam. And so those exams were in fact invalidated. And we are giving those examinees the opportunity to do retakes of those exams this year for step 1, step 2, and step 3, and then subsequent years as well. And that's free of charge. But this was an important step ensuring the integrity of the exam. This investigation is ongoing, so there are some things I can and cannot say about it, but I thought it was important at least to mention it here since you probably heard about it. And I know we're going to have lots of times for question and answers, but I wanted to give you, as I said, a sort of whirlwind tour so that we can spend more of our time in discussion engagement. Let me turn it over to Dr. Chowdhury now.
Thank you very much, Alex, and thank you, Kara. And I'd like to thank Dr. Khurram for inviting us to this stage. It's a wonderful opportunity to meet with you all. Actually, I really enjoyed the previous session because it reminded me, and I was born in Karachi. I was 5 years old when I came here, so I'm a U.S. grad, but I had the same anxieties about getting into a residency program. And at one point, just before I go into my presentation, I remember I was assistant dean at my medical school here in New York, and I remember we had a student who was applying for ophthalmology, a U.S. student, who did not even get an interview anywhere, which was very unusual. And I remember he called me in distress and he said, I didn't match. And I said, well, why don't you bring your paperwork? Let's see what happened. Let's try to figure this out, because he had pretty good scores on the USMLE. And then as I started to read his essay, as I was going through his material, I knew instantly why. He spelled ophthalmology wrong on the essay. Now, some people said in the previous program, they don't look at the essay first. But if they're inviting you for an interview, chances are they would look at your essay. So the lesson there is, please have your essays proofread by multiple people so you don't make a silly mistake like that. He corrected that mistake and the following year he got in. So there is hope for everyone, but just be very, very careful. A little bit about the FSMB, the Federation of State Medical Boards, has been around since 1912. State medical boards have been around even before then, but they got together in 1912. We represent the state medical boards. Their primary mission in life is to protect the public, and they do that through licensing, discipline when necessary, and regulation. We have a number of services that we offer physicians who are applying for licensure. Many of you may be familiar with the FCVS, the Federation's Credential Verification Service. We rely on Intel and our friends at ECFMG to help with that, especially for international graduates. But the other big program that we really value is the USMLE program. As you heard Dr. Machaber mention, it's an important joint program of the FSMB and NBME. We also have a very good working relationship with our colleagues at Intel and ECFMG, and we value all the important roles that you see listed on this slide. So in terms of how many licensed physicians there are in the United States, you heard some of the data already from Kara in terms of ECFMG certifications and so forth. There are more than 1 million doctors in the US, both MD and DO, as well as international graduates. And this number has grown by 25% since 2010. And so even though there's a cap on the number of residency positions, there has been incremental growth every year. And there are more medical schools than ever in the US as well. Now, Kara mentioned that Pakistan was the #2 country that provides international graduates to the US. But if you looked at it in terms of regions, actually the Caribbean is the largest provider of international graduates who become licensed in the US, 51,000. Actually, they surpassed India for the first time last year. But Pakistan is still there as at #3, 15,299 physicians who went to medical school in Pakistan are currently licensed to practice medicine in one of the 50 states or territories in the US. And then Philippines and Mexico are some of the other countries. So Pakistan has always been played an important role in providing graduates to the United States. This goes back decades, and there's a lot of familiarity among many program directors with many of the schools from Pakistan. So we looked at our data, just like Kara and Alex looked at their data. We looked at the data of all the international medical schools in the world, and Pakistan is #6 and #9. Dow Medical College is the 6th largest medical school in the world that provides graduates who come to the US, and the King Edward Medical College is #9. But the top 3, if you notice, are schools in the Caribbean, which have been around for a number of decades. Now, if you looked at just physicians from Pakistani medical schools, the #1 provider is Dow. There are more than 3,300 physicians who went to Dow who are licensed to practice medicine in the US. King Edward is at #2, Aga Khan #3, Sindh at #4, Allama Iqbal at #5, and then the rest. My colleague, Dr. Awan from Canada is here. His Rawalpindi Medical College is at #6. So, but of course, there are many others. And if you look under others, there's a growing number of medical schools in Pakistan. I've had the honor and privilege with my USMLE colleagues to visit both India and Pakistan and see some of the wonderful medical schools and residency programs there. How many of you are familiar with the Interstate Medical Licensure Compact, by show of hands? Okay, only a handful. So, when you get licensed in the US, you don't get a national license, you get a license from a state licensing board. However, there have been a number of physicians, especially during the pandemic, that wanted to practice telemedicine, and they wanted to be able to practice in multiple states. And so about 10 years ago, we started working with the state medical boards to create this Interstate Medical Licensure Compact. And so this is, for many of you, this is after you're done with your residency and after you've got the license. But if you meet all of these 9 criteria, participating states in this Interstate Compact are ready, willing, and able to give you a license to practice medicine instantly. But you have to meet these 9 criteria. If you don't meet these 9 criteria, you can still apply to multiple licenses, but you would have to do it in one state at a time. So this is kind of like a TSA pre-check. So if you meet these 9 criteria, you can get multiple licenses. Where can you get those licenses? The states in dark blue are the states that have adopted this Interstate Medical Licensure Compact. And if you meet those 9 criteria, you can now get licenses within a month in 40 states if you wanted to practice medicine in multiple states, whether through telemedicine or telehealth. So this is quite a revolutionary change. It also is helpful for people who practice in border states. So if you're in DC, for instance, and you also want to get a license in Maryland and Virginia, this could be a pathway. New York is not yet listed as one of the participating states, but there's legislation to introduce it there. So this helps for a number of doctors who live near borders and want to be able to practice medicine for patients who live across the border. So this is one of the major things that the FSMB has been involved with. For those of you interested in a little bit more, there's an article in the New England Journal about the history of the Interstate Medical Licensure Compact. This dates back to April of 2015. If you have an interest in this, if you want to be able to practice in multiple jurisdictions, it might be something for you to take a look at. Now, in addition to licensure, I said the state boards, the primary role is to protect the public. And one of the ways they protect the public is they get complaints from patients and others, and sometimes they have to investigate, and sometimes they have to do discipline. How often does that happen? Well, in 2023, last year, state medical and osteopathic boards issued 6,000 more than 6,000 disciplinary board actions to more than 3,000 physicians. And the disciplinary actions range from anything from a letter of reprimand to permanent revocation of your license. And I mention that because many of you are early in your careers and you're going to work hard to get your license, but once you get your license, it's also important to preserve that license. This is something you work very hard. It's arguably the most important credential you'll ever get in your life. And so be careful. And if there's a common thread in having been CEO of the FSMB now for 15 years, if there's a common thread as I've traveled across the country, is probably the number one reason physicians get disciplined is lack of communication. Lack of communication about expectations with patients who can't get a hold of you, patients who don't understand what's happening, patients who aren't fully given an informed consent, especially if you're a surgeon or doing a procedure in terms of what are the outcomes that could occur. We find that that's a significant cause of many disciplinary actions. So then let me finish up in the interest of time and talking about what Kara touched upon is some interesting changes going on across the country. This is something you're all familiar with. It's the traditional pathway to licensure for international medical graduates. Many of you are at different stages of this pathway. Last year, the state of Tennessee issued an experiment, and actually they passed a law to modify this pathway. And the way that they modified it is by eliminating the US residency requirement for all international graduates. What that means is if you're an international graduate, whether you're from India, Pakistan, United Kingdom, Australia, if you've already done training, let's say in cardiology or general surgery or family medicine, when you come to the United States and go through this pathway, certain states are saying there's such a need for doctors, they will not make you do the residency again. So that's a major change because for decades, even if you trained overseas, you were required to do the residency training over again. How many states are doing this? The states in dark blue, 8 states have already passed laws to make this happen. Now, of course, for those of you who are fresh graduates, you still have to do residency training and you're going to go through the residency process. But now another pathway could be that you do your residency training back home and then apply to come into the United States. There are many, many details that need to be worked out. One of the biggest ones is related to immigration and visa status. You know, it doesn't mean automatically that you get to be come to the United States and get to practice. There are some visa considerations, but there's a lot of details that need to be worked out. So even though these states pass these laws, the Federation of State Medical Boards is working with our colleagues at ECFMG, Intel, as well as with ACGME to figure out the details before this is implemented. So even though 8 states have passed this into law, it has not been implemented yet in any state. We're going to be working with the state boards to outline how best to do this. Because we don't want to make the process so easy that every physician from India, Pakistan comes to America. That's not the goal, because those countries need doctors too. But the idea is to put in enough safeguards and guardrails so only the qualified individuals can do this. So we're part of this advisory commission on alternate licensing models. So I'm proud to serve as a co-chair of this. And on the bottom there, you may recognize Dr. Tom Nasca is the CEO of the ACGME. Dr. Eric Hombo is the new CEO of the ECFMG/Intel. And to his left is Dr. John Combs, who's the senior vice president at ACGME. And then behind us are many of the leaders in the House of Medicine. The 16 of us are figuring out how to enable this to occur. And since we don't have all the answers, just last month on June in DC, we held a symposium where we invited a lot of international medical graduates and others from the House of Medicine to talk about what are some of the things that we should put into place to make this change happen. So some interesting things happening at the Federation as well as the state medical boards, but we're delighted to be here and to take any questions that you have. This is my Twitter handle. Happy to meet with you and chat with you. Thank you so much. Assalamu alaikum.
Thank you so very much, all of you guys. It's a great presentation and I think very insightful. So we'll move on to the questions now from the audience and up until the moderators take questions. Sure, Noman, please.
Thank you, all 3 of you, for coming in here and speaking to us and sharing your insight. Dr. Mashavar, I had few questions on the invalidation, score invalidation issue. My understanding is there's an algorithm, AI algorithm that picks up if there was an anomaly or not, which means that there may be someone who is wrongfully picked up. Is that true or not?
Thank you. I wish I could tell you that it was all AI driven, but it's not. We actually have an army of measurement scientists who evaluate performance on a regular basis. And they're, without going through the details of exactly the kinds of analyses that were done, I can tell you that the analyses were done in such a way to ensure that the results were accurate as possible. In fact, the anomalous performance, the odds of seeing the kind of score patterns that we saw in the anomalous performance incident that we've talked about were chances of achieving those results were extremely low, 1 in 100 million. That's how conservative we were in terms of ensuring that those that we were in fact invalidating were in fact a question.
Thank you. So 2 follow-up questions are, if someone's score is invalidated, what we have heard is, and they're given a date to make up for that exam, but unfortunately the date is like, say, late into December, so they're not able to participate in that match. Are you guys thinking about it, like somebody who's ready and says, okay, I may be in 1 in 100, I'm ready to retake it, is there a way for me to get through the match? And then what is it gonna look like on their transcript? Would it be an attempt or not? Thank you.
Yeah, great questions. So the challenge we faced, of course, is that ensuring the exam integrity and ensuring that the questions that were on the retake exam were in fact de novo, if you will, required time and effort to create, and ensuring exam security as we're then administering it not just in the US but internationally for step 1 and step 2. We could only really offer it at certain times of the year, and we recognize that poses challenges with the match cycle, unfortunately, and we weren't really able to avoid that. Your second question, though, is then what remains on the transcript? So any invalidated exam will remain on the transcript as score not available. And part of this has to do with our relationship with state medical boards who have implored us to ensure that there's transparency on exactly how many attempts an examinee has had. So the invalidated exam would remain as score not available, and then of course the retake exam would show whatever the new score or outcome, depending if it's step 1 or step 2 CJ.
Rahil, can you make sure that everyone sits down? This is extremely important, guys. And we have been asked these questions hundreds of times. Now is your time, so please listen to it very carefully. So first of all, Dr. Pichaber, I really appreciate what USMLE and Health are doing. We completely support 100%. We ensure that to keep the integrity of the exam, and we ensure through APPNA YPC to advocate this more. And we have been doing it through all the alumni, through all the medical schools, and through the deans. And we are hoping to get into pretty much all the medical schools in Pakistan to make sure, and that this needs to be upheld. The integrity of the exam is extremely important. We will not support any kind of anomalous, activities in the USMLE exam. So please be very careful, and please understand, guys, that this is still an ongoing. Like, recently we have been hearing also that now, just this week alone, we got 2, questions and concerns about the 2 of the candidates, and I'm sure there are more, that they attempted the exam and then they got the result as invalidated, and please avoid that. There's nothing else really here to emphasize it on more. You sign. When you're taking the exams, you're signing up something. You cannot replicate any of these things. So please be very careful, and we appreciate all the efforts that you guys are doing. Thank you.
And some of the questions that you're asking here from our own committees, that we have received those questions from all the applicants, Pakistani applicants, over the past several months. Some of them would be addressed to USMLE, FSMB, and some of them for ECFMG. So I'll just take liberty of asking question, and then I'll hand over mic to Dr. Tariq and Dr. Alam. So one of the questions that have been asked, and I'm an associate program director, that it has been discussed in the leadership as well, that if leadership can get some clarity over how things will fold out. For example, the match application season will start soon. If I'm an associate program director and I'm looking at an applicant, any IMG, especially of course Pakistan and Nepal, because their scores have been mainly invalidated. So it's a concern for me that I choose an applicant and down the line, let's say midway through the match, the scores get invalidated. Because if I am interviewing 100 applicants out of, let's say, 2,000 applications, that puts a lot of strain on us, our GME. And even I think that has happened that last year when applicants have been ranked, then they had to be let go because of that. So there were some program directors that took the liberty of ranking even they matched with their step 3 invalidated so that they could take it later. But it won't be the case if they are not ECFMG certified. So if again, as much as you can give us some clarity that how long would the process take place? Is there any like algorithm specifically that you are working to streamline the geographical location so that the leadership and as well as the people who are applying can have clarity? Thank you.
Thanks so much for the question. I certainly recognize the challenges that this poses with the match. We all do. And as I mentioned, the investigation is ongoing. I think it's important to recognize that it's just not about a geographic location. These are about evaluating performance of individuals, and they come from lots of different places, not just one specific geographic area. I think that's an important piece because I don't want to minimize that pain. Because the investigation is ongoing and we continue to monitor, it is a little hard to tell you exactly when it will be completed because we still have some examinees who are taking exams that meet the criteria, if you will, for anomalous performance. And we're going to be as mindful as we can given the timeframes. And I certainly recognize as a program director what you go through there.
Yeah, just 2 quick comments. One, I think what you bring up and what we're talking about really underscores the seriousness of this. There are no shortcuts in life, and there really are no shortcuts to the path to become licensed as a physician. So you may come across, something that looks suspicious or unusual. Be wary, and so that's something just to be mindful of. As far as program directors, our job at the USMLE is as soon as we become aware of something that suggests something unusual happened, we took action. And I remember I made several of those phone calls myself to the program directors to make them aware and to explain to them what's happening, what this means. And it's really then up to each of the programs and each of the hospitals to decide what they wanted to do. We work closely with ECFMG and InThealth. They work with the US State Department to facilitate things so that it didn't necessarily mean that people had to leave the country right away. So there are many moving parts to this issue. We're still, as Dr. Machaber said, we're still investigating, but be careful out there is my message.
Dr. Tariq.
Thank you very much to each one of you for coming here and answering our questions. I'm an interventional radiologist based in Chicago. I mentor multiple students every year. So on a similar note, we had multiple people applying for residency, going for match, and then their scores got invalidated. And it's a significant financial burden and also a lot of waste of time and efforts on programs part. So my question is, I've noticed there's a lag time, between, let's say somebody took the exam a year ago and their exam is invalidated a year later. Is there something like we can somehow make it more efficient, the process, so that if the score has to be invalidated, it is invalidated, let's say 4 to 8 weeks. So that gives the candidate enough time to retake the exam and go in for and also then the program's resources are not wasted because, we review applicants, then we pick after reviewing 15 applications, we pick one. And that one person, after interviewing, gets the scores invalidated. That's my first question. Second question is, my understanding was all the people who have had the scores invalidated, they were from Nepal and Pakistan. Are there any other countries or especially anyone in the US who have had their scores invalidated? Just to reemphasize that there is no geographical bias in any way. And my last question is, we talked about alternate pathway. Just for clarification, I'm a radiologist, we have had alternate pathway in radiology for a long time, but it needs multiple fellowship trainings. So my understanding is this licensure, you don't even need 1 year of fellowship training in the US. Is that something that could be probably implemented, 6 mini fellowship, 6 months to 9 months, and then after that alternate pathway training, they can be implemented with a limited practice capability? Thank you.
Thanks for the question. So in terms of the first question, I certainly understand the frustration about, the timing. And I'm not a measurement scientist, but I will tell you that it requires a certain volume of examinees to do some of the analyses that we look at in terms of evaluating for anomalous performance. And that in part is why it takes some time to be able to come out with the results. We're looking at continuing ways to evaluate it in a more efficient, effective way, but that's part of the measurement science behind it. The second thing, without going into details, yes, there are other countries, including the US, but as I said, it's not about countries, it's not about specific geography, it's about individuals.
Thank you.
And on the alternate licensing models, you're right. There are actually several states that have similar types of programs. They've had them for a number of years. The challenge for us is moving to the future, especially in these states that are interested in these pathways, we can only license. If you're trained overseas, there has to be some mechanism and means by which we figure out whether you're training overseas, whether it's in cardiology or nephrology or what have you, is substantially equivalent to the training in this country. And that's not easy because there is no global recognized standard at this time for that kind of equivalence for graduate medical education. There's starting to be, thanks to the efforts of Intel, at the undergraduate medical level with medical schools, there's some recognition of a global standard, but not yet in postgraduate medical education. So even before someone could be allowed to practice radiology in the United States without doing any training in the US, all those things would have to be looked into. We're also working with the American Board of Medical Specialties, because as I say, this is only about licensure. If you're going to practice your specialty, someone's going to have to figure out a way to give you that credential to be able to practice in that specialty. So we're still probably a couple of years away from that level of detail, but this is happening in a number of states. So we're trying to figure this out as quickly as we can.
Okay. Final comment, just a big thank you. Just because of IMLC compact licensing, I've been able to get my compact license in 6 states neighboring Chicago, and I go work, do locums there. So thank you for doing that.
Thank you. Follow-up questions, Dr. Machaper, on kind of the same issue. 2 questions that I've been asked very, very frequently. Number one is for those who are retaking it, and they submitted everything, however the process is that they were told. And then many candidates reached out and that it's been more than 12 weeks, they haven't heard back. So how long would that take for them to at least get the decisions of what they're going to do?
Yeah, so I think we had sort of 2 questions embedded in there. One is the sort of process for the retake. We evaluate the different testing centers that we're going to use for them, and the process has been 60 days prior to the exam, providing registration information in terms of testing centers. The dates for 2024, we have already been conveyed to everyone who has asked. So that's been conveyed. The actual testing centers is the piece that we continue to evaluate. So for step 1, for example, which will be given on August 14th, we have the testing centers, both US and internationally. That has been conveyed to those individuals who are taking step 1. Step 2 CK is in September 27th, and step 3 is on December 12th and 13th in the US.
So by this, it means that whoever has not received any correspondence, their exam will not happen this year.
Well, anybody who's had an invalidation and wants to take the test in 2024 can in fact do so. And if they haven't received notice from us, by all means, they can let us know. And I think your second point was about people asking for reconsideration. No,
the same thing kind of.
Okay.
And then the next issue that we've been hearing recently is people who failed I think step 2, they have been asked that they cannot retake their exam for a year. That is something extremely new that is coming up now. And we trying to understand why was that. Not that there's no sort of any invalidation, but because they failed. So why are they being asked to retake the exam after 12 months?
Yeah, thanks for that. That's a process, by the way, that we've had for a very, very long time. And this is anomalous performance on the other end, people who have performed very low, and so much so that frankly, it requires us to provide a pause, if you will, in testing. And that's where we've now instituted a pause for at least 12 months in many ways to help the examinee to ensure that they're prepared, because the level of performance on the exam has been so low that it requires concerning, at least from that perspective. And that's not new, but
right. And on the same kind of point. So, for example, I mean, it can be a really bad day for someone, and then they just fail. Now they consistently perform well throughout their medical school. Is there a process for them also to be reconsidered based on what they have? So, is there any process that they can retake sooner?
Absolutely. So when somebody is paused, if you will, or restricted from taking USMLE for 12 years because of anomalous performance on the low end, in other words, poor performance, there is an appeals process that we make examinees aware of. We have a committee for individualized review that they can appeal to, and that committee could then adjudicate whether or not that pause should be taken away, if you will.
I will request from audience if you have any questions, Dr. Alam, and then I'll come to you. Thank you.
Hi, my name is Dr. Alam. I'm with YPC. I've been with the organization. Thank you, Dr. Siddiq, for having you guys, and thank you for coming. Appreciate all you guys do. I know what a hard job it is. A lot of the questions people have asked already, so I wanted to just kind of ask you guys. A lot of times, and this is a very stressful process for candidates, no matter where you are in the world, like sometimes perception is not reality. And when something comes up, I think everybody do their due diligence to make the investigation and look into things. If there's something that you can tell the candidates, to kind of ease them, that the process is being, worked out, how would you guys tell these guys to stay focused, stay content, and that everything is in the right, that you guys are doing everything in your power to make sure that they're being taken care of? I think that's the biggest thing, that the questions that we get, a lot of it's because people don't know, and I, being American born, I know I've done the ECFMG, I've gone through it all, I trust you guys. I want them to feel like you guys can be trusted as well, and I think a lot of anxiety will be taken away from the students knowing that you guys are protecting them. Thank you.
Appreciate the comment and the question. We do everything we can to ensure that the process is fair and equitable for all. And we adhere to really the highest professional standards because we want to ensure that everyone has the same playing field and the same opportunities to be able to train in the US. I think that's an important piece. We're very sensitive to the issues that arise. We certainly value, as you heard from Kara and Hank and others, the international medical graduate community is crucial to workforce in this country, and we value it tremendously. So we want to ensure that the playing field is level for all.
And I will just add, I think, Alex, you said it earlier, and I think it's important to emphasize, is that the number is very, very small compared to the actual number of international medical graduates. And even in all the regions we just mentioned, but compared to those numbers. So I think that is hard to focus on sometimes when if you happen to be the individual that is impacted, and it may seem that the whole entire, breadth of your community is impacted, but it really is not. It really is a very small number of individuals. And I think the other piece of advice that Dr. Chowdhury gave was to stay focused, and if something looks not right, it's probably not right, and to stay away from it.
I think that's a great question, Dr. Khurram. I think the other thing I would say is, when we shared you the slides about how well Pakistan is doing, we share that not just to make you feel good, Pakistan has a track record. The medical schools that you graduated from have a track record. The program directors know that, the hospitals know that, the licensing boards know that. And so you're fortunate that you come from a country where you have very good medical schools and your graduates are serving as physicians across the country. They're serving as department chairs, CEOs of health systems and hospitals around the country, and in important roles that you will one day fill as well. So be realistic, talk to others, go to sessions like this so you can learn more, because the more informed you are, the more confident you can feel about the path that you're taking. You also have to be realistic. I've had friends of mine over the years who kept trying year after year, and after 6 or 7 years, I mean, you know, there might be opportunity to think about a plan B sometimes. But certainly, because it is competitive, certainly do your best. Don't give up hope. Ask people for advice. Talk to program directors. Talk to colleagues who've gone through the process. It works out for many, many people, but not everyone. So find out what makes for a successful path and try to follow that. But don't give up hope and be strong. Thank you. So I have a question and then a comment. So my question is, and she just walked in and asked me a question that I wanted to ask. Step 3, whether it's going to be pass fail, it's still going to be 3 digits. There are some rumors about that topic. So I hope you can clarify, and then I will make my second comment.
Sure, I certainly mentioned it for step 2 CK. I probably did do it for step 3. There are no plans to alter the scoring for step 3, so it will remain as it currently exists with the score and pass fail outcome.
Thank you. My second comment, and you know, I'm going to say it in a very humble way, but I also want to advocate for my IMG community. When and I'm a psychiatry program director in Connecticut. When this score invalidation came out, and obviously we need to penalize people who use unfair means to get the scores, and we need to do it. But we all support transparency in the process. But the way the communication came out, it named certain countries. It named Nepal, it named Pakistan, and some other countries. We make IMGs make 50% of US workforce, and I'm proud of that. And then there was a whole social media backlash. And when we tried to, being me there, Ahmed there, we tried to say that, you know, not every IMG is cheater. All of them are hard workers. There might be some who did this, and they should be penalized. And I don't care about comments about myself. I'm passed through this at that phase of life. The comments were made that you're also a cheater. So I think, you know, USMLE could have worded it better, but should not have named the countries or the country of affiliation of those applicants. And above all, we support transparency as program directors, as someone who has been in APPNA YPC for 10 plus years. But you know, at the same time, so that brings a bias in the minds of the program directors. Thank you for listening.
We'll take one last question and then we have a few more. So we'll just go a little bit over time here if you guys are okay with it. Because again, it's very important topics. Ahmed.
Hello, this is Dr. Iqbal. I'm a graduate from Pakistan. I want to ask a question about the invalidation process. Since the invalidation process, there's been a lot of talk on social media how it scrutinizes the candidates who are really outliers, who are cheaters, from those who are really well tested. So one of those, I don't know how much of that's true. That's why I'm gonna take your comments on that. One of the ways the ECFMG scrutinizes is if a candidate is performing really well in difficult questions that have a very low percentage of answering them correctly, versus the same candidate answers some of the simpler ones really wrong, then ECFMG might scrutinize, might filter them out as an outlier. So I wanted to know how much of that's true, because some of the candidates might answer some of the questions really well in the exam because of their grip and those systems, and might skip some of the simpler ones. And the second thing I wanted to ask is, I know this is a complicated process. ECFMG might not reveal all of their algorithms, but I just want to know how much of that's true and what are the different processes of scrutinizing. And the second question is, recently, a lot of candidates are having their step 2 scores below 0. They are not invalidated when they perform really well in their exam, and when the results pop up, there's just a 0 below 0 percentile results. I want to know about those candidates, what's their future, and how much time does it take to ECFMG to reevaluate their applications, since the math process is really coming out. That would be all. Thank you so much.
Thanks for the question. There are a number of different analyses that were used to determine the validations, including agreement analyses, including the amount of time taken on taken on each item, for example, and a number of different things. Without going into a lot of detail that I can't share. Those were the kinds of statistics and measurement science that were used to determine the anomalous performance. And as I mentioned, using a very conservative marker of the likelihood of this being an accurate performance being 1 in 100 million. So a number of different factors went in there. And again, we used a very conservative marker there. The second question about step 2 score percentile being less than 0%, Dr. Chatterjee and I were talking, that's a rarity. I mean, it doesn't occur very often at all. In fact, I don't see it often.
Thank you, Dr. Chatterjee. So we'll move on. I guess what you guys need to understand is, number one is obviously there is going to be zero tolerance about any anomalous means that's going to be used, and we absolutely stand with it. There's no question. You name it, you don't name it, the social media, it's painful. You gotta be, talked about. I mean, don't pay attention to the social media, whatever is going on. The significance is obviously great, but like Kara mentioned, and Dr. Machaber and Dr. Chaudhary, the number is extremely low. It's like less than 50, for example, from Pakistan, it's about 50-ish of the applicants were affected, for example, and out of the 1,000+ candidates who took the exam, right? There are, at least I believe in the last 3 years, the investigation was going on, it's about like maybe 4,000 to 5,000 Pakistanis who took the exams, and this is very, the number-wise, it's extremely low. So again, you gotta trust that. If you're gonna get into the system, you have to trust the system. And this is they have done this for longest period of time. So you got to trust the system that this is what's going to be, and avoid by any means. So moving on, I think we'll have to take a few questions from the ECFMG also. The most important one, it's going to be a long one, and I guess I have to understand it myself too, that what it means. So basically, the DS 2019, so residence physician research scholars, they require J1 visa. And most recently, ECFMG and Department of State allow the signature and digital copies of DS 2019. But ECFMG is still sending physical DS 2019 via regular mail to the programs. So this requires about 3 to 4 weeks and costs a lot of ECFMG as well as the program. Meanwhile, the resident physicians are unable to start their visa process as required by DS 2019. So 3 to 5% of these get lost in the mail between ECFMG, the program, and the applicant. So bottom line is that can we do it digitally? Does it make sense? I'm trying to understand.
So the question makes sense. I am not a subject matter expertise in the J1 visa. So in terms of that process and how, because I know we accept DS 2019 digitally, I'm just not making the connection between us mailing it to the program. So if you can send me this question and who asked it, then I can get a specific answer.
Sure, but this can be done digitally as well as you.
I know that the DS 2019 right now is being done digitally, but I don't know what the very specifics of it are.
So we can follow up.
Yes, please.
We have a question here for ECFMG. Good morning to all. This is Vishal. Thank you for allowing me to ask a question.
So I have a question like nowadays like OIT has replaced CS and we know the CS is really challenging and very highly standardized. But the people who have taken OIT for multiple times and it is not appearing on their transcript that reading. But the people who have taken CS, their transcript shows retake and it really affects the matching process. Don't you think like it is not realistic approach to the candidates who have done the really highly challenging exam as compared to OET?
Thank you for the question. The USMLE Step 2 CS is part of the USMLE sequence. That is still, there are certain individuals that are certified on the basis of the USMLE Step 2 CS. So the transcript that you're referring to would be a USMLE transcript. So ECFMG is not producing transcripts for OAT or for USMLE, because USMLE is going to show a history, like Alex said, it's or Hank or both. But the USMLE exam is important for the state boards. So obviously also important for residency program directors, but your transcript for USMLE is going to show a whole history of all of the exams and attempts that you took for USMLE. OAT did, I know it colloquially seems like it replaced CS. That's not entirely accurate. Our Pathways program is what we implemented when the USMLE Step 2 CS was suspended and then terminated. We needed a way to be able to assess the clinical skills, clinical communication skills, and the English language proficiency. So the OET is testing English language proficiency and some of those clinical communication skills. And then the other part of the Pathway program, the 1 through 6, is testing the rest of the clinical communication skills. So it is taken as a combined element for certification. And that would show on a status report for ECFMG. So I understand your question and your point is well taken. It's just, it's a little bit apples and oranges because the CS was part of the licensing exam series and we're using OAT to demonstrate partially your English language proficiency, if that helps.
Go ahead. I do understand, but I think like it is really considered for the people who attend CSs. So their matching process is really affecting as compared to the person who have taken OIT. I think CFMG must rethink this process because the applications are really considered in a bad way and they are getting affected. This is my
Thank you.
We'll take the last question.
Yes. This is Dr. Moeen from South Africa. With due respect to ECFMD, why the ECFMD certification should expire in 2 years when you haven't landed a job in the accredited program? Because the foreign graduate is still practicing in the country of his origin and life goes on for him as a doctor. So like when you put in additional requirements for revalidation of the certificate, it is really like difficult for them, and I think I am suggesting that whether you take it or not, it's another thing. Whether the certificate should be valid for 5 years so that they should be they should find a job.
So thank you. The point is well taken also. And in part of my updates, I mentioned that we are going to be releasing information about how pathways can be revalidated. So this is not publicly available yet, but the certification cycle is a 3-year cycle for pathways. And we do see that generally folks, when they match, they're matching within 3 years in 3 cycles. There will be the opportunity to revalidate that for those that do not match in that cycle. And that information will be published shortly on how one will go about revalidating that. This is actually the process that for certification that was in place prior to the introduction of the USMLE Step 2 CS. And really what it has to do with is the currency of your clinical communication skills and your English language proficiency. So if you are not in practice in GME in the United States for that period of time, then you need to reassess those skills in order to be able to enter again. But there is information forthcoming probably within the next month or so about the specifics on how to do that revalidation for those that are in practice already in another country as well.
On the same exact note, so I have at least 5 questions asking about almost the same thing. So their OET ECFMG certificate will expire on whichever date based on the website. So how can they get their recertificate expiry date extended in order to have the match? So that's it.
So that information is forthcoming. It should be published. But in fact, I looked at all the drafts have been signed off on already. So it should be published very shortly by the end of the summer.
Thank you so much. My name is Tariq Rahman. First of all, I would like to thank the organizing committee, great program. Thank you so much, and great presentation for sure. We know that our organization APPNA is a North American organization in America and Canada, and as a matter of fact, geographically Mexico is part of that too. But just my question is about the practicing physicians in America and Canada, how their credentials are recognized across the border and the opportunities for that. Thank you.
So that's a great question. I think it's starting to change because the Canadian provinces are recognizing they have a need for physicians. Historically, they've required US licensed physicians to take the licentiate exam of the Medical Council of Canada. But I think some of the provinces, you may know better than I, are beginning to look at whether they can accept the USMLE and not require another licensing exam. Looking at it the other way, many of the state medical boards, not all, many of the US state medical boards accept the qualifications of the licentiate exam of the Medical Council of Canada. So right now, one might say it's easier for Canadian physicians to practice in America than for American physicians to practice in Canada, but this is in flux because both nations, like much of the world, is in need of physicians and they're trying to loosen barriers rather than creating more restrictions.
No problem.
One question I had also, as like progress is made, sometimes people like to make changes through ECFMG or examinations, especially nowadays hiring physicians, because I serving with my organization, I hire a lot of doctors and even med students. Things have changed so much in the application process, and there's a big emotional component to hiring people or students and stuff like that. Have you guys ever thought about changing the test process and not just, I know there's a huge medical component to just taking the test and that's all about your medical knowledge, but how can you incorporate for the students coming from all across the world, the emotional quotient and the, of how organizations are run nowadays, med schools are run nowadays, and it's a big factor that I don't think we're teaching our med students or even adults, coming into the society and things are changing a lot. Is there a way that you think that can be incorporated into your exams in the future? Thank you.
Yeah, it's a terrific question, actually, and it's one that we continue to think about on a regular basis. In fact, one of the things when the clinical skills exam went away, there were clearly gaps that we identified within the USMLE exam overall. Communication skills, clinical reasoning skills, and a number of others, team-based skills, professionalism, etc. And what we started doing actually was with subject matter experts who work with us on a regular basis, is really thinking about developing additional tools that can be implemented within the USMLE. So we actually have been working on new item types specifically to look at clinical reasoning skills, communication skills. Those were the two we decided to tackle first. And what we're doing now is unveiling them in more formative assessments that the NBME provides with the intent of being able to evaluate it further and ultimately make its way into the USMLE in the future. And then add to that other additional item types that are harder to create, admittedly, professionalism, you talked about emotional intelligence and so forth, with systems-based practice and a variety of others, that there already are some existing tools, but thinking about how we might incorporate those in the future to a licensing exam are certainly the future for sure.
Stay tuned. Thank you. We will be wrapping up. We have 2 questions from the applicants here.
Hi, my name is Sushay. So my question is from ECFMG regarding the OET exam. So when I was applying for the OET exam, I was offered an OET at home and I attempted that exam. It took 2 attempts because some technical issue happened in between it. it was today. And after taking my exam, I was told by a colleague of mine that OET at home is not accepted by the ECFMG for the pathway certifications. So I got the issue solved, calling, emailing, and a lot of stress. My question and comment is like going further, what's the procedure for that? Because still I'm waiting for the certification to happen. And is it going to be valid, or are you going to stop offering OET at home? That's what.
So the first thing I'll say is connect with me afterwards so I can check specifically on your status. As it relates to the OET, we don't administer the OET, so that's administered by another organization out of Australia. And so I don't know what the breakdown is happening between them and us, because we do have a very good working relationship with them, obviously, because we're using the OET exam scores and they do come into us through a portal and they have to meet certain requirements. So OET at home was offered during certain times to certain individuals, but not generally, I think, accepted for us. So I think we'll have to connect after individually so that I can make sure I give you the right answer about your specific certification.
We'll take one last question.
Hi, I'm Julia. I'm a addiction medicine fellow, and I completed my residency in emergency medicine from Qatar. I have a question from Dr. Chaudhary. I wanted to ask you that after this 2 years of supervised practice, state of Tennessee is offering, are we board eligible?
So that's a great question, and I touched on this previously before. We are, at the Federation, we only do licensure. Beyond licensure, there are going to be many individuals like yourself who are trained in various specialties. And so this is why it's important for us to have the American Board of Medical Specialties, which is at the table, with whom we have to work this out. I believe there's some interest on the part of some of the specialty boards to figure this out in a ways that make sense. Because there's no point in coming up with these laws if they can't be applied. And so stay tuned. Hopefully Tennessee is actually, since the first state to pass this law, is probably the first state that's going to implement some details. And we're working very closely with the Tennessee State Board of Medical Examiners to figure that out.
From July 1st, and then they are not still clear about it, and still they are making a decision whether it would be a academic program. I mean, this is not yet clear.
Yeah, it's being worked out literally as we speak, and we're in frequent contact with the Tennessee authorities. But as I mentioned, there's several other states that are also looking at this as well, and we need to figure this out sooner rather than later.
So a quick comment on behalf of all the YPC, all IMGs, and especially the Pakistani origin IMGs. I would like to pay my gratitude to all of you, because I think all of us have asked very tough questions, and I think if I was in your position, I could not have answered it better. So your answers were to the point and very transparent. So thanks a lot, and we really appreciate it.
Thank you. So we will end the session here. I sincerely appreciate all of your times. This is great, and we cannot thank you enough. The 4th of July weekend, you guys taking your time out of your family, coming in, attending, answering all the questions that we have. We really appreciate it. We hope to keep this going on, and then thank you again for all the things that you've done. Thank you.